to speak on the issue that I'm going to raise with you, because last month was the worst October on record for numbers of citizens on trolleys in our hospitals. Almost 8,000 people, and they included infamously a 91-year-old patient who spent 29 hours on a trolley. And in the first 10 months of this year, almost 80,000 Taoiseach, that's a small town, were on trolleys, the highest ever figure for the first 10 months of any year since Trolley Watch began. And according to the INMO, for the 15th month in a row, October 2015 saw an increase in the level of overcrowding in emergency departments. Taoiseach in Dundalk, 25-year-old Dulta Donnelly bled to death while waiting for an ambulance to arrive, despite the fact that his family home is only 5 minutes from the Dundalk ambulance station and 5 minutes from the Louth County Hospital, where the A&E department has been closed. And his mother, Una, said, "I feel my son died because of politicians' promises." Taoiseach, do you agree with the President of the Irish Hospitals Consultants Association, Dr Gerard Crotty, who has said the cause of A&E overcrowding is a lack of capacity because not enough money has been allocated to deal with it? And will you acknowledge that the public health system requires much greater investment by your government to deal with this crisis?
Thank you.
Thank you, Deputy Adams. The public health system also requires much greater levels of management and the use of resources of taxpayers' money. This morning's count at 8 a.m. Were 300 patients waiting on trolleys, according to the report from Trolley Gar, which does this every day. Last night at 8 p.m. there were 152 patients waiting on trolleys, and at 8 a.m. yesterday morning, that was Tuesday the 10th of November, there were 320 waiting on trolleys. As you know, the numbers always decline during the course of the day. The Minister for Health convened the Emergency Department Task Force in December of last year to provide a real focus and a momentum in dealing with the challenges presented by emergency department overcrowding, for which there are many reasons. And good progress, I have to say, was made in the implementation of that task force recommendations. The delayed discharges have reduced steadily from 830 last December to 567 on the 3rd of November this year, which frees up about 265 beds to be used by acutely ill patients every day. The average number of patients waiting for greater than 9 hours on trolleys in October was 115, down from 173 in February before that. Waiting times for the NHS funding have reduced from 11 weeks down to 3 to 4 weeks. As you recall, we were told before that if you put money into that, it would alleviate the problem. It hasn't done so, despite the serious reduction in the waiting time. Transitional care funding has continued to support 3,000 approvals, which is very much above the original target of 500. And 1,200 additional home care packages will have been provided by the end of this year. 173 additional nursing home beds and 65 short-stay beds are now open. And in addition to that, Deputy Adams, 117 million has been provided in 2015 extra to help relieve pressure on acute hospitals. I'd be the first to say to you, this is not the way I would like it to be. But clearly, the request for resources, the request for extra capacity, the request for extra staff have all been met in part by the Minister and his department and the HSE. 74 million in April of this year was allocated to reduce delayed discharges and lower the waiting times for fair deal, as well as providing additional transitional beds. 18 million was allocated to support acute hospital systems over the winter period by providing additional bed capacity to deal with these very problems.
Thank you.
And this additional funding has come on top of all measures already taken when the government provided 25 million to deal with those acute hospitals. For the winter capacity, Deputy Adams, the Hospital groups have now all provided particular plans at Concorla for each of their hospitals in their groups in respect of what they propose to do and how they propose to implement an integrated approach across primary, community, social and acute services to manage winter pressures, the scale of which we don't know yet, obviously, because of what may occur with weather and particular flus or whatever else.
Deputy Adams.
I asked you, Taoiseach, to acknowledge that the public health system requires much greater investment. You ignored that. Your response was peppered with, "This is not the way I would want it to be." The Minister has dealt with these demands in part. We need much greater levels of management. And then, without a sense of shame or embarrassment, you announce that today there are 300 citizens of this state on trolleys. What sort of a Taoiseach are you? You can stand up there like a commentator and give us this figure. It is the case that 300 citizens are on trolleys as a direct result of government policy. Not an accident, a direct result of what you're doing. And last week the Minister for Health said that CEOs of hospital groups should be allowed to transfer management of hospitals to the private providers.
Thank you.
He went on to say that hospital groups should be able to conduct business in the manner of semi-state companies, and I quote, outside the constraints of public service rules. Now, these are shocking and revealing comments which highlight the ideological position of this government, which seeks ultimately to privatise our health services and leaves patients at the mercy of a profit margin. And the silence of the Labour Party in the wake of Minister Brodker's Thatcherite proposals is notable.
Thank you, Deputy. Your question, please.
John Cordian, aye. Will you accept? Taoiseach, will you accept?
Sorry, Deputy Byrne. Deputy Byrne, please. And you too.
John Cordian. Deputy Byrne does come in from the side
Deputy
all
Byrne,
the time.
Please, we're over time.
He has no shame whatsoever
Thank you. Put your question.
about the record of his party. So
Deputy Byrne, would you please? Thank you.
Will you accept that the comments of your Minister for Health have fundamentally, on top of the policy of your government, undermined the public health system? And isn't it time that you either stand up and admit that he has let the cat out of the bags, that the long-term plan of this government is to abandon the public ownership model of healthcare?
I disagree completely with the last sentiment that you express. You ask what kind of Taoiseach I am. People will judge that in due course. But I would like to say that I was given the responsibility and the honour of leading a government to take this country out of an economic mess that we inherited, to restore our public finances, to create an economic engine that can deal with the many challenges that our country faces in the social area, in the health area. But at least, Deputy Adams, you're getting the truth as of this morning, as I gave it here for yesterday morning and the reduction in the numbers yesterday evening. And I pointed out to you the delayed discharges, the monies allocated for Fair Deal, the numbers employed extra in the health service, the extra beds that have been opened. Clearly, the health situation in a country with an ageing population is always challenging. There's over 13 billion of public money going into the system at the moment. There are some very good things happening in health, and there are some things that are not so good. This is a challenge. This is a real challenge every day, and I commend those people who work on the front line. Last week we had a question about a 91-year-old who was 29 hours on a trolley. This is not acceptable in any circumstance. And when I say that, you say that I'm a commentator. We try to provide the resources for the professional staff to do their job. Extra staff, extra beds, extra public money, and proper management in these systems.
Thank you.
And the Chief Executive of the HSE has visited all of the hospitals where there are particular problems. And I hope that the plan put in place by the Minister will now bear fruit for the future.
Deputy Halligan, thank you.
Thank you, Ceann Comhairle.